I take drug. Everybody takes drug and uses drug for a variety of reasons. But the law has made some drugs legal, while some are considered illegal. Drugs became a public issue in Nigeria by the 1960s, with discoveries of cannabis farms in the country, arrests of Nigerian cannabis traffickers abroad, and reports of psychological disorders. However, it was not until the early 1980s that the problem of drug trafficking became a major social issue, with the potential of disrupting international relations, heralded by the 1961 UN Single Convention on Narcotics Drugs. 50 years down the line, how have we been fighting the war? Nigeria, situated in West Africa, has progressively become not only a transit route for illicit drug movement from Latin America to other parts of the world, but also has become a consumer country.
Illicit drug use is obviously a challenge in the country as a whole. This is really nothing new. Back to the late 50s when we started studying this problem, there has always been some form of illicit drug use. Initially it was only cannabis and some stimulant drugs. Beginning from the 80s, middle 80s, we started having problems with cocaine and heroin. Obviously, it was mostly trafficking at that time, but we know that because of trafficking, the drugs came into the country, and much of it, some of it stayed in the country, and young people in particular started using.
Illicit drug use is a challenge in Nigeria, and I believe it is even for the sub-region. In our centers across the Federation, we have 36 state commands, and we have, in each of these commands, we have a counseling department for counseling, and then we do treatment in conjunction with general hospitals and psychiatric hospitals, a reference kind of situation. In all these places, at all times, when you go there, the overriding number of persons that are there are predominantly the youth population.
Illicit drug use among the youth is a challenge in Nigeria. In fact, the fact that the youths are the workforce, or they make up the major workforce in the country, makes that population a very serious population. You find that Nigeria has been a transit route for illicit substances, and because of that, for substances that cannot find their way out or through the country or find their way into the country, are likely going to be abused within the country.
Drug use is generally a challenge in Nigeria among young people at the moment, both licit and illicit drug use. The nation at the moment is not only a transit country anymore, but also a consumer country. So today we have many more young people initiating drug use. We have many young people experimenting with all variety of drugs, both licit and illicit. From some of the research findings that we have seen, and from the experiences working through communities and everywhere, we can see that we have a growing drug problem, and many young people are getting involved. Even considering some of the national research work that has been done, talking about the integrated biological behavioral surveillance survey, most of the injecting drug users that were interviewed were reportedly to be young people. So we have many young people who are already using drugs.
I started using drugs at the age of 15. When I was in secondary school, I got introduced into smoking marijuana through a friend, and from then I started getting exposed to other drugs.
Using drugs at the age of 22 when I was in secondary school. So by then I started with cigarettes, then I went down to Indian hemp. Then later on I was introduced to other drugs like tramadol, Refnol, Exol, and heroin.
I started using drugs when I left the primary school over 15 years ago. First, I started by smoking cigarettes, and I graduated to the extent of taking marijuana, which you know as Indian hemp. Since then, it has been very, very difficult for me to quit the craving, the urge, and it became part of me that I cannot do without it.
Let me state that the use of illicit drugs, and in fact the abuse of illicit drugs, is a problem only to the level that it comes with risky behavior. The level of drug dependence, one of the key features is the loss of ability to control intake. You see the effects on the person's physical health. Their health deteriorates, they have various ailments. You see the effect on the person's psyche. Some drugs could actually cause a breakdown and development of mental illness, while others could actually lead to various psychological disorders. They cause strains on relationships. These also affect the person psychologically. They cause impaired functioning occupationally. They cause impaired functioning in school. They cause impaired functioning in almost every sphere of life.
While I feel young people use drugs is that they derive pleasure in it, they derive fun in it. Once your friend, if you are not piling up with them, they feel that you are outdated. So you become something else. What I really want to emphasize is that why I really see the essence of people taking these drugs is that, number one, they feel that there is something that they are missing while they are not taking these drugs. So they are influenced, they are kind of, okay, let me try. People they get inspiration from this. The musicians of our time today, Bob Marley, all these stars, all these legends, they feel that it's what they are smoking that do give them the inspiration. They want to give it a try.
I think the reason why most people use drugs is because of peer influence, number one, environment, and sometimes parents too contribute to. You meet your friend who smokes maybe, or who drinks, he tell you, let's go out. Maybe you tell him you don't drink. He start telling you are not a correct man, look at you, why will you tell me you won't drink, you're a Jew man, all those kind of things. He will use words now that will influence you, and before you know, you say you want to drink. And then environment matters. If you are brought up in an environment where drug abuse is the usual thing, as you're growing up, it gets to a point in your life at your adolescent age, there is anything you see, you really want to know how far with that thing. You want to test that thing, you want to know why that person you saw doing that thing is doing it, what the benefit is gaining from it. And then the parent aspect. Even your child is a smoker, or he drinks, is an alcoholic, is addicted to alcohol, or he abuses other drugs, you don't need to start abusing him, resenting him. You can encourage him, show him love, talk to him, make him see reasons why there are dangers attached to all those things. Most people in the society come to look at drinking, smoking, and abusing of drugs as the main factor of addiction. There are other forms of addiction. Lying is addiction, stealing is addiction, sex is addiction, masturbation is addiction. And then they don't capitalize and put their mind on that aspect on how to help those people. They only rather look at those people who abuse substance. And mostly those people who smoke marijuana and drugs are the ones that really face the challenges.
Most of the time, it's all about trafficking, no trafficking, seizure of a large container of drugs. We are so oblivious to the fact that we have users in Nigeria, and that over the last 10 years, there's an increase of usage of cannabis, cocaine, and heroin in Nigeria. If you look at it, we have a lot of adulterated cocaine on the streets, crack cocaine, which is about 50 naira. So what are you talking about? It's not a lot of money to get drugs, really. And if you are looking at the affluence class, then we are looking at a gram of cocaine. We have different classes of cocaine. in Nigeria. We have the Bangkok, we have the China, we have everything. So people actually can afford these things. It's not a lot of money to get high, really, at the end of the day. So I think we are just oblivious to the fact that we are users in this country. We are oblivious to the fact that people can afford it. We are oblivious to the fact that it's everywhere. That's why we don't have policies around it. We're still so oblivious to a lot of things in Nigeria.
I would say that it appears emphasis is on interdiction, emphasis is on supply reduction rather than a balanced approach that is recommended by the United Nations in the 1988 Convention. We need to balance our approach.
Emphasis on interdiction far outweighs the emphasis on counseling or on treatment. And it is very clear because both of us are coming from two different areas. The law enforcement agents, but from the medical model we stand for, says that people become addicts. People use drugs because they have a biological, in other words, a medical problem that makes it imperative on them to be using drugs. Rather than apply the criminal justice system to punish them, I think we should think more about the medical model to treat them and assist them to get over their problem. Interdiction, I fully support. Whatever government does to interdict and punish those who peddle and traffic in drugs, I think everybody should go for that. But I always urge government that those who use are victims of a problem and they need help, and we should try to help them. The law enforcement approach has been the predominant approach for many years. The problem is that you cannot just arrest people out of the problem. The problem is not all about trafficking, it's not all about supply. The problem now in Nigeria is the issue of use, the issue of demand for drugs. So arresting drug users does not help at all in this side of the problem. We know that people are using drugs, people are becoming dependent on drugs, and people are needing care for their drug behaviors. So we cannot just focus on law enforcement only, because that way we're not going to get out of this problem.
Young people who use drugs face a lot of health and human rights challenges within our country. Many of them do not have access to health care because they are believed that they are the object of law enforcement, and therefore it is very difficult for them to come out to the public space to identify themselves as somebody who uses drugs and seek health care when the need arises.
Government also sees the user, that is the consumer, also as a criminal, which is, to me, is more of a problem. It's not going to help the matter. I think the criminal is likely or should be the person who cultivates, the person who distributes, and the person who sells. But the person who buys is a victim. Even though in a sense he may have a choice, but you find that the issue of illicit drug use is an issue that might likely be beyond the individual once he has made himself or she has made herself available and begin the use of this substance. So the law that criminalizes the user who is seen as the victim is an area of concern.
The law protects them. Why I say the law protects them is that if the law does not make room for demand reduction is a complete package: counseling, treatment, and rehabilitation, and even reintegration.
In Von Christian Center, we have the doctors that comes every day, know how you are faring, and there are nurses also that can attend to your case at any time when you need medical services. But in NDLEA, there is no doctor there is no nurses there that come. The doctor just comes once in a while. While I was there, I did not come in contact with any doctor asking me, how is your health, how are you doing? I was just kept in the room. When it's time for food, they give you your food. When it's time for your drugs, the officer come and pass your drugs to you. But yeah, involved. You have nurses, they have files. When you've taken your drugs, you know, they underline that you've taken. Like in the morning, they will come and wake you and take your temperature. But in NDLEA, nobody knows maybe you are even there. That's just the plain fact. Oh, that's the truth of the whole matter. If you misbehave, they discipline you to the extent that you even want to look for a way to run away from that place. And in such issues, most of the people that are there, they even escape. In NDLEA, I was beaten, I was flogged, and to the extent that I was not saying my time just finished for me. Your mind will not be concentrated in the program or the treatment going on there, because the way they handle you as if you're an animal.
First of all, dealing with human beings, and I think as human beings we all have rights which need to be respected, and quite a bit of that is not happening when law enforcement is the predominant approach to dealing with the drug problem. It is a public health problem. Somebody who is abusing a substance, somebody who is dependent on a substance, addicted to a substance, needs help. He's not a criminal. He needs help, he needs treatment, he needs rehabilitation. And those are the things that I do not have, and we need to have.
Harm reduction in Nigeria 5 years ago was a no-go area. People didn't want to understand what harm reduction. They don't want to talk about it, because once you mention harm reduction, the moment people just flip and they are wondering, oh, what you mean is OST? You mean that you want us to bring methadone into Nigeria? Or the next thing, oh, you want needle exchange? You are trying to westernize us.
The whole idea about harm reduction is that how can we reduce the harm, the adverse effects that we talk about in drug use? How can we reduce the harms, the adverse effects in drug use while individuals are still using drugs? Because let's tell ourselves the truth, it is impossible to get people not to use drugs completely. It will be utopia. We'll be talking about a kind of a world of utopia, to think that there will be nobody, everybody will be abstinent of drugs. Even the people in charge of policy, they still do use drugs. They drink alcohol, although we have accepted it as a social thing, but we know that alcohol also causes problems. We all drink coffee. Remember the popular saying that some people say, you coffee yourself to death, because they know that coffee is a stimulant, and the more stimulated they are, the more they drive to work, their ability to work. So some people coffee themselves so much that they begin to get the negative effects. So even those of us saying don't use drugs, we all use drugs, you know, but we may say we're able to manage it. So what we are saying is that, okay, you want to coffee yourself to be able to produce. Can you use it in a way that you minimize the side effects, the harm that will result from it?
Harm reduction in principle said, let me use a few examples. Harm reduction with sexual practices says, with young people, we can't stop them from having sex. So instead, let's reduce the dangers that might come from having sex, things like unwanted pregnancies, STIs. And how do we do that? Let's distribute condoms. Let's encourage safe sexual practices. That's harm reduction. Harm reduction with cars, for example, says we can't stop young people from driving fast. That's what they do. They do crazy stuff. However, let's encourage them to put on their seatbelts when they're in a car. So harm reduction with drugs and substance use in general is a good concept. We can't stop young people from experimenting. We can't stop them from trying out drugs. But what we should do, or what we must do, is try to see where we can reduce the harm that comes from that. Through various things have been proposed. For example, decriminalization of drugs.
I mean, there is certainly nothing wrong with harm reduction. I think it is one of those strategies that we really have to think about, especially with injection drug use in the country.
Pentu, mostly that drug is designed for people who have sickle cell anemia because it's a painkiller. But some of them now decide to be using it as a drug, and they do that by injecting themselves. The vein on their body, they inject it, they will go to the pharmacy, get the drug, get a syringe, then you know what, in fact I know of somebody who was looking for a vein on his body due to the way he have injected himself. The veins are all hidden. He was looking for a vein.